So now, based on all of these concepts that we've talked about, I've built a troubleshooting tree. So when there are breakdowns, what are things that you can think about? So first, I have sort of a dotted line between resonant voice and the diagnosis, because that diagnosis is going to impact vocal fold vibration, it's going to impact vocal fold closure, muscle tension patterns, all of that sort of thing. And then how the patient is compensating or using their voice in the presence of that diagnosis. So we have diagnosis, and then we have resonant voice. Now there are three components that we talked about, right? The three subsystems of voice production, really: air, the vocal folds vibrating, and resonance. The vocal folds vibrating may be that diagnosis, potentially. Then we have airflow and breath on the left. We have a tension factor in the middle, and then we have resonance on the right. So it's identifying, what is the breakdown in this patient? Are they kind of using this voice? They're forward, but they're strained. Maybe they're a little bit pressed. They're not exhaling very much air. So we talk about under airflow, consistent exhalation. Laryngeal valving, I was just using too much pressure at the level of my vocal folds. And we can talk about tactile feedback. So that tactile feedback comes under the consistent exhalation of air. I can use my hand. I can feel air on my teeth and lip. I can feel air on my finger. So for consistent exhalation of air, we use tactile feedback. And then for reducing laryngeal valving, we may also use tactile feedback. And that also has a dotted line over to effort under the tension component. So under tension, we might have effort, like the person is working really hard, and we might also have tightness. To reduce effort, we may reduce laryngeal valving. To reduce tightness, we may address jaw release, tongue release, the release of the muscles in the anterior portion of the neck, the back of the neck. We also may start to think about the tension that people are holding in their rib cage. So maybe the breath and the tension component are intertwined. And then we talk about resonance. Now, resonance can be impacted by jaw opening, by tongue placement, and by airflow. So we can troubleshoot with airflow. We can go back to that left side of the screen. We can talk about tongue placement. Where is the tongue placed in the mouth? Is it clenched in between the teeth and along the roof of the mouth? Do we need to release the jaw and the tongue? So if there are things that are not going right, here are some decisions, a little decision tree that you can go through. If you can start to identify the initial breakdown, then you can try different things to try to reduce some tension or improve airflow to achieve a resonant voice.